Ontario's health minister lathers up in Toronto today as she tries to quell growing concerns about an outbreak of C-Difficile at 7 Ontario hospitals. So far, 20 people have died after contracting the deadly bacteria inside Ontario hospitals since May. A bacteria that usually isn't fatal, but always has unpleasant side effects.
C-Difficile is it's a very watery type diarrhea that people experience.
C-Difficile is considered a superbug because it's antibiotic resistant, which means no pill or drug can 100% kill it. Hospitals in Guelph, Mississauga, Orangeville, Welland, and Niagara Falls are currently dealing with the C-Difficile outbreak. Now, that many hospitals dealing with an outbreak at the same time is rare in and of itself. But more concerning is the high mortality rate, especially in Niagara Falls, where 16 of 66 patients who have contracted C. difficile have died. In Stratford, there have been no deaths associated with C. difficile this year, although there have been 9 C. diff patients in the hospital, including one current case, although that was brought in from the outside. That's about the average. And to keep C. difficile at bay, nurses, doctors, and administrators are stressing hand washing.
With soap and water for C. difficile because it is a spore, and alcohol hand sanitizer does not kill the spore. It really is our first best defense.
Hand washing isn't the only solution, though. At a recent demonstration in Stratford, CUPE suggested that dirty hospitals are to blame, and they suggest that cutbacks to hospital cleaning staffs are contributing to 5,000 superbug-related deaths in Ontario each year.
Part of the thing we're fighting here is the culture of complacency amongst hospital administrators, the Ontario Hospital Association, the Ministry of Health, all of whom are telling the public that it's acceptable that large numbers of people die from these diseases, when in other countries, in fact, we've been much more successful at driving death rates down.
The health minister can't promise an end to C. diff outbreaks, but says they'll break the bad news to Ontarians quicker in the future.
I think more information is better, and I have asked my ministry officials to work with the Ontario Hospital Association to come up with guidelines on when do we let the public know, what is the appropriate time, and how do we do that.
In Stratford, Scott Miller, A News.